Thank you for joining us for our webinar today, Implementing Dental Membership Plans. Before we get started, I wanted to mention that there's a chat feature for this webinar, and you can ask your questions at any time during the presentation. The chat button is at the bottom of the PowerPoint as you hover over it. We will answer all the questions at the end of the webinar during the Q&A portion, but feel free to ask questions via chat as you think of them. Our presenters today are Matt Vanderloo and Laura Zock. Matt and Laura are both CPAs and principals with SVA's Dental Services Group. They provide advisory, accounting, and tax services to dentists and their businesses. They work with dental practices of all sizes, from solo practices to group practices with multiple locations. Matt and Laura use their knowledge of the dental industry to help dentists on many aspects in their practices, including our topic today, dental membership plans. And with that, I will hand it over to Laura to get us started today.
Great, thanks, Jennifer. Welcome, everyone. Today's topic is dental membership plans. And you've probably heard about these in the marketplace. Some people call them dental membership plans. Some people might refer to them as in-house membership plans. Some people call them a discount plan. Really, we've got several names here for the same concept. Today in our webinar, we're going to refer to them as dental membership plans, or you might hear us shorten that to DMP as well. So our objectives for today are to make sure that by the time you get off this webinar that you'll have a good idea of what a dental membership plan is and its key features, why you should consider offering one at your practice, what benefits your patients should see with a dental membership plan, what benefits your practice should be with a dental membership plan, and then some specifics on how to establish one, how to price, and a couple of special considerations to keep in mind as you consider whether or not to offer a dental membership plan in your practice. So the first point we're going to cover today is an important one, and that's what dental membership plans are not. And as you can see on the screen here, dental membership plans are not dental insurance. There are many things, but insurance is one thing they are not. One of the keys to having a successful dental membership plan is to make sure that you've set it up in such a way that it's not considered dental insurance. And you'll want to check in with your state insurance commissioner or check your state insurance laws depending on where you're located to make sure that you're designing, setting up, and operating the membership plan in such a way that no one's construing it as insurance. Now, Matt, can you kick us off by going through what exactly is a dental membership plan?
Sure. There are a couple really specific things that we look at to help determine it's a dental membership plan, and a couple things that we see that are pretty common to most of the clients we work with who have dental membership plans. So the first one, and this one is always true, a dental membership plan is always office specific. And that can be if you're a practice that only has one geographic location, one office, it's specific to that office. If you're a larger practice that has multiple offices under the same name, you can have one dental membership plan that covers those offices. But it's always specific to your practice, your office. You can't take it, somebody can't sign up for the dental membership plan in your office to take it across the street to a competitor. So it's always specific to your office. It's not portable like an insurance plan would be. Typically, there's a set fee charged per member, either on an annual basis or a monthly basis. And that set fee then covers a group of services, usually exams, cleanings, and x-rays. Anything not covered by that set fee, there's usually some sort of a discount that is offered to the patient. Some plans will split out those set fees and do a different rate for children in a plan or do a different rate for perio patients who are in your plan. And then they might even do a different rate or a different discount for a whole family that signs up for the dental membership plan. It's really at a high level what your dental membership plan is, but really it's a set fee that's covering a group of services and then a discount for any other services that are outside of that. So why might your practice want to offer a dental membership plan and have that available to your patients? The first one is it takes a lot of excuses off the table for why patients might not want to accept the treatment plan you're proposing. A lot of patients use the crutch of, I don't have dental insurance, for the reason they don't want to go and see their dentist or they don't have a regular good relationship with their dentist. This dental membership plan takes that excuse off the table. This is a way to give patients something that looks and feels like dental insurance to them that isn't dental insurance and really breaks down one of those walls for why they might not want to come in or why they might not want to do the treatment plan you're proposing. It also inspires a lot of loyalty in patients. Those patients who have the dental membership plan have a strong incentive to want to come back to your practice and do all of the treatment, all the work they need done at your practice because they've already paid for some of it, or you're giving them a discount on a lot of it too. These plans are really easy to access and easy for patients to sign up for. There's no sort of pre-approval process. There's not a big insurance application. They can't only get it through their employer like health insurance. It's really easy for them to come into your office, do the quick sign up, pay the fee, and be a part of your dental membership plan. And then the last thing is it can really shift the responsibility in the relationship between you and your patients, and it really empowers the patients to have to take more of a proactive approach to their dental health care. You know, the previous model, the current model for a lot of practices, the patient comes in and then the practice works really hard to schedule that follow-up appointment with the patient to make sure they're coming back into your office. The dental membership plan can kind of flip that and really puts the pressure on the patient. When they sign up for the dental membership plan, they've already paid for those cleanings and those appointments. And now it's up to them to make sure they're scheduling it and make sure they're coming back in to see you in the practice. So it makes for a nice switch there and really empowers the patients and puts more responsibility on the patients in the practice.
And Matt, not only does it empower the patients, but it also empowers the practices as well. It puts the practices in a position of control. If you think about it, your typical patient that has dental insurance comes in with a fee schedule and a payment plan that's set up by the insurance company. And when the number of insured patients decreases and costs rise, insurance companies have the power and control to maintain their profit by decreasing payments to dentists. With a dental membership plan, your practice has control over setting the price and the fee schedule and the payment timing as well. Here, your practice controls the revenue stream, and you have choices that you can make and put yourself in an empowered position. And also, Matt, as you mentioned, another one of the good things about having a membership plan is that it's less paperwork. There's no insurance companies to contract with because it's not insurance, less paperwork to process payments, et cetera, for your dental membership plan. Another reason to offer dental membership plans is the potential for new patients. We see these as a marketing tool that your practice can use to attract new patients, especially those patients that don't have dental insurance. And as Matt talked about, offering the membership plan can reduce non-insured patients' viewpoint of having a barrier to great dental care at your practice. It also will help you secure a future for your practice through the membership program, where your members will have the ability to continually renew their memberships and continue to see you for the dental services that they need. Another benefit that you should consider from the practice perspective is that dental membership plans have the ability to help increase acceptance rates on additional work, such as your restorative and cosmetic procedures, due in large part to the discount that the plan offers its members. Patients are also motivated to get in for their hygiene appointments and regularly see you, since through paying the membership fee, they've essentially already paid for their appointments, and they want to make sure that they come in and use the value that's provided by that membership plan. Another reason is that they're affordable. Dental membership plans are relatively easy and inexpensive for a practice to set up and to keep administering. And if you've done it correctly and efficiently, there aren't the costs and complexities that you tend to see by having contracts with many insurance plans. Matt, what are some patient benefits that we see with a dental membership plan?
I think that there are really three big benefits we see to patients: affordability, the budget-friendly aspect, and some clarity. So to expand on those, typically a dental membership plan is really affordable for a patient. The patient isn't paying much more out of pocket than they would for those services if they didn't have the dental membership plan. And typically they're getting a little bit of a discount, maybe a 10 or a 15% discount off those. So it's really inexpensive for a patient to sign up. There's not a big out-of-pocket cost, so it's a really affordable way for patients to get their dental care. And it can be really budget-friendly for your patients, too, because it doesn't have to be an all-upfront, pay the whole membership fee at once the moment you sign up kind of a plan. You can make it even more budget-friendly to your patients if you want to break that payment up into 4 quarterly payments or a monthly payment every month, and make it really easy for patients to be able to afford that and make it really cost-competitive for them. The other really big thing is that these plans are typically really easy for a patient to understand and are very clear about what benefits are covered and what the discount is going to be. They're unlike most traditional health insurance plans with deductibles and out-of-pocket maximums and excluded plans and excluded benefits and lifetime caps and all sorts of confusing things. that is really tough for the patient to understand. The dental membership plan is really clear. The patient should be able to understand really easily what they're paying, what they're going to get for it, and what they're going to have to pay for any services that aren't covered. And because of that, there are some patients that are ideal to target with a dental membership plan in your office. Obviously, one of the easy no-brainers is any patients who don't have dental insurance through their employer and are just paying out of pocket. This is a great product to offer to them to inspire that loyalty back to your practice. They might work for an employer who's really small and doesn't offer dental insurance. They might have their own business, be an independent contractor, and don't have access to a dental insurance plan through work. So they can be a great group of patients to look at and target with a new dental membership plan in your office. Retired patients are also a great population to go after. These might be patients who've been retired for a while and don't have access to any dental insurance or any kind of a plan, or patients who are about to retire and are about to lose that dental insurance they've had with their employer and are looking for something else to help cover them and bridge that gap between the dental insurance they used to have and a retired life without any dental insurance. There also might be patients in your practice who have access to dental insurance, but it's just too costly through their employer right now. They might be looking for a more cost-competitive, more affordable answer to that, so your dental membership plan could be a great way for those patients to get access to care. And then finally, if you have patients who are covered by a dental insurance that you're not accepting in your office, the dental membership plan could be a great thing to talk to them about. They might be able to give up that dental insurance that they're not getting any benefit for through work and sign up for your dental membership plan and have access to the care, to the discount, and feel like they're in the same place. There are lots of other patients who are going to benefit, but these are 4 kind of demographic groups that we see a lot of benefit to and can really benefit and use your dental membership plan. So that's from a patient perspective. Laura, how about from the practice perspective? What are some of the benefits to the practice?
Sure. One of my favorite ones is one we've touched on a little bit already, but we'll cover it a little bit more here, is using the dental membership plan offering as a marketing tool for your practice. If you've got a website set up for your practice, which this day and age, everyone's got a website right now, you can have a link to your dental membership plan on your website, or you can have information posted on your website about the specifics of that dental membership plan. And your website is up and running all the time, right outside the hours at your practices. So in the evenings when people are sitting at their computers trying to do some research on changing dentists who they want to see next, they can come across your practice and find information about your membership plan too. So it's a marketing opportunity that can be on for your practice 24 hours a day, 7 days a week. When you think about it, if you don't have it on your website too, most new patients are going to call your office when you're open to schedule that first appointment or maybe ask some questions about your membership plan. There is an opportunity to drive people to call your practice and have a personal conversation with your receptionist about what is the plan, what are the benefits of working with you in your practice, et cetera. Another practice benefit is that it helps create consistent income and consistent cash flow for your clinic. Whether you have your membership plan set up to have patient payments processed on a monthly basis or a quarterly basis, or even if it's just an annual basis, the dental membership plan helps generate consistent and regular income for your practice because you're continually accepting payments for the membership plan itself. And if you're on a less frequent payment plan, then when you look at annual renewals, you'll have those expected incomes coming in as well when your patients renew their membership plan. And what we've seen within the practices we've helped set up their membership plans is that the patients really enjoy it and they are going to keep renewing and renewing regardless of what your renewal period is. Also, when your hygiene appointments tend to be light, if you've got some days with some cancellations due to weather or illnesses, as you might be seeing now, when you have those membership plan incomes still coming in, that helps create the consistent cash flow for your practice so it's there to pay your bills. We've also talked a little bit about the patient loyalty aspect and how this is a benefit to your practice. When a patient signs up for your membership plan, it helps strengthen the relationship between the patient and the practice because you're able to provide their dental care at a reasonable price and they have greater understanding for what is all included. And because of the discount and because you're helping remove the barrier to say yes to additional services, they're more likely to accept additional treatments because of that discount they're getting. So now that we've talked about what a dental membership plan is and why you may want to offer one and why the patients really like it, let's talk about some more specifics on how do we actually get a membership plan started. The first aspect of this is going to be around the design piece of the dental membership plan itself. And the components here are figuring out, first of all, what pricing are you going to set this at? What is the fee? How frequently are you going to require payment, whether it's annual, quarter basis, monthly basis, and what services are going to be included. Typically, what we've seen around with dental membership plans is some practices have the annual fee set as low as $275, but we're more seeing, $300 to $350 for a regular general dentistry practice these days. Some of it you will see vary based on where your practice is geographically located to, so it's important to know what's going on in your own local marketplace and price your plans accordingly in order to remain competitive. Another thing to consider is what discount are you willing to provide on the additional services for your patients. You might want to consider giving a different discount depending on whether that patient is paying in cash or via check or with credit card payments. If you think about it, every time you swipe a patient's credit card, you're paying a credit card transaction fee that's probably anywhere from 2% to 3%. So you might want to offer a different discount to account for that additional cost that you have when you process a credit card payment. The other thing to consider is services included and what is in the annual fee component of that, or what might you offer as additional services based on the percentage discount that you're willing to give. Some practices also exclude certain services, like perhaps you're not willing to offer a discount on braces or orthodontia as a part of this plan. So it's important to keep that in mind too as you think about the design of the plan. The next component is education. And here this covers educating your patients, educating your hygienists, educating your front desk staff, really anyone within your practice. You want to be prepared that when someone picks up the phone and calls your practice, that the people in your clinic answering that phone are well informed about your membership plan and have some of the main talking points to talk with your patients about it. Next is going to be marketing the plan. This includes should you put your plan on the website, should you have marketing material in your lobby and at the front desk, perhaps a one-page handout type of thing that covers the key components of the plan for you to hand out and use as a guide for having discussions with your patients. Also, you might want to consider doing a marketing campaign to your surrounding areas around your office based on your geography. This might just be the push that someone needs to help them make the decision to change a dentist. Or also, once you have some patients signed up for the dental membership plan, tell them you're looking to expand it and have them help spread the word on your behalf as well. Next with plan design then is figuring out how do you price the plan?
A great question and a really important one is you're thinking about setting up your dental membership plan. You want to make sure you price it right from the start. In my mind, the first big step here is you want to determine what level of discount you want to offer with your dental membership plan. Typically, we're seeing most plans have a discount of somewhere between 10 and 15% built into the plan. You want to compare this to the insurance contracts you're signed up with. What kind of a discount are you offering patients who are signed up for insurance? Want to compare this to what your cash prompt pay discount might be for people who are paying on the day of service, and making sure you're setting it up in a way that makes sense compared to those other discounts. I have seen a couple plans that do have some sort of a one-time initial enrollment fee that kind of covers the setup of getting somebody set up in the plan and those administrative costs you might have up front. So that might be something else you want to consider when you're thinking about price. After you've got the discount figured out or any initial sign-up fee figured out, the next big piece of the puzzle is determining what services you're going to include in that standard fee. And taking a look at those services and what your standard fee for those services would be, and looking then the discount you're thinking about offering, and is that where you want to set that initial plan price. You want to make sure you're looking at what this fee would look like at your competitors too, and what their dental membership plans are set up to be. So compare this to your competitors. You don't want to price yourself too high or too low compared to your competitors. And as a part of this too, you really want to make sure you've got a story to tell your patients. Why should they be signing up for the dental membership plan? What are you offering in the plan? And you really need to know your patients and your practice to make sure you're offering the kinds of things, the kinds of treatments and benefits that they're going to want in your plan. And you're going to want to know how you want to care for your patients. Are you okay just doing bite wings at every appointment, or do you want to be doing panels at some of your appointments? And if that's the case, you need to build that cost into your membership plan fee and make sure you're including all of that and thinking about all of that when you set up the plan and set up that initial fee. Some other special considerations that you have to think about when you're setting up your plan. Make sure you're not combining this with care credit. Patients can sign up for your dental membership plan, use the benefits under that dental membership plan for any services you're providing, and then they're paying for those services at the time you're providing them. They don't also get to use care credit and spread out that payment. They can pick one or the other, but not both. You really want to think about the timing of the payment for the membership fee in your dental membership plan. Do you want to do it just once a year, or do you want patients to pay quarterly or monthly? You've got to balance out how much more administrative time you're going to put on your office staff if you're billing more frequently for that, with the benefit of getting that regular and consistent cash flow into the office for folks who are paying on a more frequent schedule than just once a year. I think the majority of plans we see are still doing it just once a year for that membership fee, but you could certainly look at doing it more frequently to smooth out that cash flow. You're going to need to have some sort of tracking system set up, some way to administer the plan and know who's signed up and who's eligible for these discounts, and when their membership year ends or their membership period ends, and how you're going to sign them back up again. Automatic re-enrollment is something to think about. Once somebody signs up initially, do you want them to automatically be re-enrolled every year and to resend them a bill or charge them somehow for that? Or do you want to have to force patients to think about that and re-engage them every time their period of dental membership plan is running out and it's time to re-up? And then finally, from an administrative standpoint, how do you want to handle this? Do you want to take it all over in-house and have your office staff administer all of it? Or do you want to contract out with somebody else to provide that administrative process for you? Still, most offices we work with are still doing this on their own and are able to handle this within their office with their existing staff and aren't having to outsource this, but there are plenty of options if you do want to look at outsourcing the whole administrative process related to your dental membership plan. So with that, Laura, how can we help?
Glad you asked, Matt. There's a number of ways that SVA can help you in your practice as you're thinking about what to do about a membership plan, whether you should implement one or not, and then the specifics of how do you make it all happen. So one of the key areas we can help with is helping determine pricing. Knowing what services you want to offer and include in that plan, we can help you price that out, whether it's based on what you consider to be your standard level of service to your patients, bite wings versus panel, or if you want to have a separate perio plan too, knowing that that's additional appointments and additional services as well. We've helped our clients set up a number of dental membership plans. We've helped them price it. We can help you avoid traps before you get into them with these plans, and we can help set the rates to make sure that the plans are profitable from the start too. We've got a lot of market knowledge in the dental industry, and this really helps us price the plans and know your competition and know what should be included in the plans too. On the design side, we've worked with the OCI here in Wisconsin in particular to help make sure that these membership plans aren't set up in such a way that they're considered under Wisconsin's insurance laws, and we can use that experience to help you set up your plans as well. And then a lot of the other work we do is on the monitor and tracking side of dental membership plans. We can help you create the reports and the tracking systems that are needed to help with patient renewals and help track the profitability of the membership plans as well. Really how we see this is a dental membership plan is a really effective incentive way to bring in new patients who want affordable care and who don't have insurance to offset the cost. So we think every practice should consider having one, and we're happy to field questions about that.
All right, so one question, one great question here so far. There's lots of companies out there who will take over the administration for a membership plan for you. One of the questions is, a lot of those membership companies advertise that they're on top of the re-enrollments and handling that process for you. What else are they doing that people are finding advantageous? So I personally I can only think of one client company I work with that is using an outside administration service. Everybody else is handling it in-house with their own staff. I think the re-enrollment is a big one. Lots of the membership companies like to tell you that and stay on top of that re-enrollment and handle that re-enrollment process for you. And most of them will handle all of the admin for you. So they'll make sure that people are being offered re-enrollment. Some of them might set up a separate page on your website to handle anybody who wants to enroll in the plan online and seamlessly handle that for you. They can set up the credit card payment if you want to allow people to be able to pay via credit card right off your website to enroll. They'll report back to you on who's enrolled and what they're paying, and then handle all that administrative task work that needs to happen in your office to keep people re-enrolled. I haven't heard of any companies that handle this for folks who are offering any other big advantages. Usually it's that kind of stuff. They can get it set up for you, they can help you price it, and just handle all the enrollments, re-enrollments, payments for you.
And when you're checking out your options too, you'll want to be cognizant of the fees that they're charging for those services. We've heard that the fees can be pretty hefty, and that's been a consideration that dentists have taken into their thoughts when they're deciding whether or not to outsource it or to keep that work in-house. If you have staff with the availability to have a bit of time to help administer the plan, often you're able to implement these plans at little to no added cost within your practice.
All right, before we get into the next question, just wanted to remind everybody out there that if you do have a question, just open your chat box and type in the question, and we will be sure to answer it. Next question that came through, what are the most common services typically covered by a dental membership plan?
Most commonly, we see that dental membership plan is going to cover 2 cleanings a year, 2 exams a year, and any x-rays that are necessary for those appointments as well. And then everything else, cosmetic and restorative, isn't covered by the plan other than whatever discount the plan has built in is applied to those services. So that's the most traditional, typical structure. We've seen lots of different variations off of that. I've seen a couple plans that only cover the exams and the x-rays and don't cover the actual cleaning, and then the plans are priced a lot lower since that big service is excluded. I've seen some plans that have thrown in 1 or 2 emergency appointments every year on top of those other services. I've seen plans that have thrown in whitening or some other unique cosmetic things too, and then have adjusted the price accordingly just to generate some more experience or more attractiveness to the plan and to make it stand out from some other plans.
All right, another question that's come in is any experience or advice related to renewals and keeping the credit cards on file to charge at renewal time? A couple points on renewals. I think frequency is a key thing to consider when you're designing your plan. And that would be whether it's a monthly fee, quarterly fee, or an annual fee. You'll want to make sure that you're setting it up in such a way that you don't have someone coming to see you, has their appointment, and you put them on a monthly payment plan, spreading that cost out over the year, and then they're able to cancel right after that, right? You want to make sure that you're able to, get fair compensation for the services that you've provided. Also, in terms of renewals, I would say the less frequent you do them, the easier it is. What we tend to see people use is some tracking sheets in terms of when members have signed up for plans, and then a reminder system in terms of reaching out to patients about having them handle the renewal after that year has gone by, or ultimately designing the plan so that it auto-renews, so that you're not needing to reach out to them continually or on a regular basis. That also then puts the responsibility on the patients to reach out to you in order to cancel.
Yeah, well, just one add-on there, and it's really, we're not going to go into any depth here because it's well beyond the scope of this presentation, but if you are keeping and storing client credit card numbers, be very, very careful and make sure you're doing that very securely because there's consumer protection laws related to that issue. And you don't want to have some sort of security breach at your office and open up that can of worms because you just exposed a bunch of credit cards.
All right. Well, we are at the 30-minute mark for this presentation. Wanted to thank Matt and Laura for presenting this information to us today, and to all of you out there for tuning in. If you do have any questions in the future, Matt and Laura's contact information is on your screen. Feel free to reach out to them at any time, and they would be able to help. Thank you again for joining us today, and I hope everyone has a wonderful day. Thank you.